So a nurse, lab technician, or another healthcare professional trained at drawing blood will take a sample using a small needle. Then they will add chemical to the sample to see how it react. So it usually takes about 11 to 13.5 seconds to clot. So if the blood takes longer time to clot, so your doctor may determine that you have vitamin K deficient. So the lab may also look at the result in different way, measuring the international normalized rate ratio, INR. INR is based on a scale that compares results of different laboratories worldwide. So for someone who takes coagulants such as warfarin, so the time to blood to clot may be a little bit longer. So they have to refer to the INR. So normal INR is about 0.9 to 1.1. And for someone taking a blood thinner, it might be about 2 to 3.5. So your doctor will be looking to see if the number is too high. Next.
So what happened to the patient?
What happened to the patient?
Yes. How long does it take for her blood to clot?
Depend, because when after the high care provider draw the blood, they will add some chemical, and then I think it may took a day. It's not too long because we want to see if the blood can clot quicker or late.
In the case of the patient, in this case, how long does it take for her blood to clot?
Maybe about longer than 14 seconds because she has bleeding.
When you draw the blood from the patient, we have like lots of tubes, test tubes. Yes, with a different cap color. You realize that? Small blood sample, 5 ml tube or 6 ml tube.
Yes.
Okay, you have the one with the red cap. You remember? That you send to the pathology lab. Once you take the blood sample, maybe 5 ml or less. Okay, so you put it in the cap, the red cap. And we have lots of other cap, tubes with other caps. Among of them, we have the purple, we have the green one. So why does these, tubes have different color?
When I Google, it say for red cap, the sample type that we take is for serum. And the additive is fully clot activator for determining the serum biochemistry, serum immunology test, or blood banking test.
Okay, so the red cap, do they have the additive or not?
Yes, clot activator. Yes, they have additive.
Okay, so sometimes the red cap don't have the activator. Okay, because people use it. Even the red cap, we have like different types of the red cap. Okay, so always you need to read the label, okay, to be on the safe side. But generally the red cap don't have the additive, especially the glass one. Okay, so we don't put any additive. But if the red cap have any additive, maybe they will mention in the label. And mostly the red one and the yellow one, we use it for the assessing the serum sample, means for the hormones, okay, for the serology, for specific protein they want to find out inside the blood. So you use the red one, okay, or the yellow or maybe orange. So always know that each of these test tube, they have a different function because they has been sprayed. If you look at, closely, you will find out that actually there's lots of water droplets being sprayed inside the surface when you thought it was like an evaporation, but it's not. Okay, so it's actually the anticoagulant, or maybe there are coagulant in it. If you have this, whole blood putting into the purple one, for example, it is containing the EDTA, and that is anticoagulant, means the blood will stay longer. Okay, they will not clot. But if you have the coagulant like the yellow one, orange or red, they contain coagulant. You can see that they are more taking quicker time to precipitate and aggregate or clot. Okay, so always read the label before you put the blood sample in it and send it to the pathology lab. Different tube for different tests. Maybe you need a couple of them, or maybe 3 or 5 for different tests. All right, so each of them may have the coagulant or may not have coagulant, or they will have the anticoagulant to prevent the blood from clotting. So if you want to relate, the functions of vitamin K is to what? To help clotting or to prevent clotting?
To help
clotting.
To help the clotting process. So if you don't have vitamin K, or your vitamin K is deficient, all right, so you need to consume more vitamin K from the food, right? Sometimes from the injection of vitamin K. This is to prevent, okay, continuous blood from flowing out from your body. So you're helping your body to clot the blood, okay, once you got any injury. Okay, continue.
For the treatment and the prevention is the medication is phytonadione, which is vitamin K1. It is used to treat vitamin K insufficiency The majority of the time, it is prescribed as an oral prescription by doctors. It could potentially be injected under the skin by a nurse as opposed to intervene a muscle. The adult dosage is ranged from 1 to 25 milligrams. If you were using an anticoagulant, the doctor will prescribe a lower phytonadione dose. This dosage is usually between 1 and to 10 milligram. This is to avoid complication caused by anticoagulant interfering with the body's production of vitamin K. At birth, infants or newborns are given a single dose of 0.5 to 1 milligram vitamin K when at birth. If the mother is using anticoagulant or antihistamine medication, a larger dose may be required. For the prevention, on average day, the recommend to consume 120 mcg for males and 90 mcg for women to be appropriate for preventing vitamin K insufficiency. Some foods such as leafy green uh, spinach or broccoli can provide you with all of your daily requirement in just one serving. A single dose of vitamin K given at birth can help newborns avoid developing a problem.
So next is the complication of vitamin K deficiency. So number one is bleeding. Heavy bleeding after an injury, heavy menstrual bleeding in gum or nose bleeding can be dangerous. That means the bleeding will be dangerous to the person. Underdeveloped fetus, internal bleeding of the fetus, damage of the skull of the fetus, malformed fingers, and deformed facial fetus. If the mother have the vitamin K deficiency. And then number three is vitamin K deficiency bleeding in infants. Okay, intestine is not colonized with useful bacteria that have the ability to make vitamin K. Okay, and then number four is osteoporosis. Vitamin K also plays a role building strength. And then number five is cardiovascular disease. The activation of matrix gamma carboxyglutamic acid protein, the most potent inhibitor of cardiovascular classifications. And then number six is chronic kidney disease, and then also Alzheimer's disease, because functions of vitamin K in mental health accumulate. Scientists propose that vitamin K deficiency could add to the pathogenesis of Alzheimer's disease. Next.
The last one is etiology of vitamin K deficiency. The first one is because of taking coumarin anticoagulants. Coumarin anticoagulants will inhibit the release of plasma clotting factor VII by vitamin K in liver slice from vitamin K deficient animal without inhibition of protein synthesis. The next one is because of fat malabsorption. It will interfere with production or secretion of bile pancreatic lipase, such as cystic fibrosis and pancreatitis. It will damage to internal mucosa and cause of motility disorder. So the last one is risk in newborn infant. It is because the first one is the breast milk is very low in vitamin K. The next one is vitamin K doesn't transfer well from a mother's placenta to her baby. Next one is the liver of a newborn infant doesn't use the vitamin efficiently. And the last one is because the newborns don't produce vitamin K2 on their own in the first few days of life. So,
So when you look at the common pathways or extrinsic or intrinsic pathway, where is vitamin K? Where is vitamin K in the pathway? Is vitamin K is considered as one of the clotting factor? Anyone? Where is vitamin K? In the clotting mechanism or in the hemostasis. Where does the vitamin K play a role? Anyone? Where is the vitamin K in this mechanism? So when you talk about the etiology, so you have to relate with the nature of vitamin K with in relation to the case. Where is the pathway? What did he does? Anyone? Putri, where is vitamin K in this section?
In taking coumarin anticoagulants, maybe.
Where is it? Where is it? Is it in the intrinsic or in the extrinsic?
Uh, I'm not sure.
The answer is in the slide that you have mentioned previously.
Or
Vitamin K involved in the intrinsic or extrinsic or in the common pathways. You have the answer in the slide, you already put it. Anyone? Yes. Yeah,
Is it in both extrinsic and intrinsic?
could be. You have the pathway. Anyone? Okay, go back to your slide. Show me your slide. Go back. Go back. Here. One more. Slide number 4. Okay. So point number 3. Dot number 3. These substances are necessary because they are cofactors for gamma glutamyl carboxylase and vitamin K2 3-epoxide reductase complex in modifying gamma carboxyglutamic acid on clotting factors 2, 7, 9, and 10. Okay, you don't need to remember all the names or the difficult name, but it's best if you can simplify the words, okay, the sentence. It says that the vitamin K is not the main clotting factor. We have around 16 factor, okay? So the vitamin K is not in one of those, okay? On its own, vitamin K don't have any job. Okay, they cannot depend on their own in order to help the clotting factor, to help the clotting process. So we call vitamin K as an additional component. If it's additional, we put it co in the front. So it's cofactor for another clotting factor for the 16 one. But specifically, the vitamin K is used to make what? Factor number 2, factor number 7, factor number 9, and 10 only. So if you look at the intrinsic pathway and also the common pathway, you can see that this factor 2, 7, 9, and 10 is there. And that is where the vitamin come into action and help the clotting process. Okay, the vitamin K is essential or important in making a new clotting factor because the clotting factor may be used up. So you need a continuous supply of the cofactor, which is the vitamin K. But vitamin K on its own, they cannot function. Okay, they can just helping for the formation of these 4 factors. All right. So that means that you know that your body cannot make the vitamin K, and of course you need to take it from the fruits or from the food of vegetables or leafy green. So you have to take these plants that are rich in vitamin K in order to supplement, okay, the vitamin K that is already being used up, especially when you lose your blood. Okay, so you need to replace them very quickly. But in some other people, okay, some healthy people, they have this capability. Okay, they don't have any issues. Maybe they have enough vitamin K and that is, you know, don't have any problem. Okay, so we can say that the vitamin K is the cofactor for the formation of factor 2, 7, 9, and 10. On its own, they are not considered as the main clotting factor. All right. Okay. Anything else you want to show me? Is all for today? So short, very simple one. You don't like it. You hate it. Because doctor is keep asking me. It's okay. No more slide?
No.
Okay. So when is our next PBL?
Already done the PBL.
You don't want more.
No.
You want more case? I have another case, additional case. The exam is approaching. So when is your examination?
End of June. End of June.
24 June.
34?
Yes, 24 June for anatomy. If I
34. 34.
24.
24.
Yeah.
Yes, you have lots of time, so we can have another 1 or 2 session.
It's okay, doctor. We can save for our next semester.
You want to meet me again in the next semester?
Why not?
I thought you hate me. You hate me.
No. We love you.
You don't want it. If you love me, then let's do it. I will give you another trigger now.
No, we have to save for the next semester so we can meet again.
Okay. So what subject you are taking this semester?
Anatomy, patho, pharmaco, health assessment.
Anatomy. Yes, for my part, anatomy, you have to focus on the electrocardiogram. Okay, electrocardiogram, the ECG for the MCQs. For the MEQs,